Hi everyone, welcome back to our channel. Today we will discuss about the most important topic for the nursing exam point of view, nursing MCQ and PYQ, Digoxin. Digoxin is an important drug. Today we will discuss about the MCQs. First question, the primary action of digoxin is to option A, decrease the myocardial contractility. Option B, increase the myocardial contractility. Option C, dilated blood vessels. Option D, decrease heart rate without affecting contractility. The answer is option B, increase the myocardial contractility. Digoxin is a cardiac glycoside that increase the force of myocardial contraction increase, that will increase to improving the cardiac output and in heart failure. The answer will be option B. Next, the usual therapeutic serum digoxin level is option A, 0.1 to 0.5 ng per ml. Option B, 0.5 to 2 ng per ml. Option C, 2.5 to 3.5 ng per ml. Option D, 3.5 to 5 ng per ml. The answer is option B, 0.5 to 2.0 ng per ml. Next question. A patient on digoxin develops nausea, vomiting and visual disturbance. The nurse should administer the next dose as scheduled. Option B, hold the dose and notify the physician. Option C, encourage fluids and continue the medication. Option D, give an extra dose to maintain the therapeutic effect. The answer is option B, hold the dose and notify the physician, because the patient develops the nausea and vomiting and visual disturbance. So these are the early sign of the digoxin toxicity. The dose should be held and serum level should be checked. So the answer will be option B, hold the dose and notify the physician. Next, which electrolyte imbalance increase the risk of the digoxin toxicity? Option A, hypernatremia. Option B, hypokalemia. Option C, hypercalcemia. Option D, hypomagnesemia. The answer is option B, hypokalemia, because low potassium level enhance the digoxin binding to myocardial cells, increasing the toxicity risks. So the answer will be option B, hypokalemia. Next, the nurse should monitor which vital sign before the administer digoxin? Option A, respiratory rate. Option B, temperature. Option C, apical pulse. Option D, blood pressure only. The answer will be option C, apical pulse, because digoxin causes the bradycardia. Therapy is held if the apical pulse less than 60 beats per minute in the adults, and we should check the apical pulse for the 1 minute. So the answer will be option C, apical pulse. A common visual symptoms of digoxin toxicity is option A, tunnel vision. Option B, diplopia or yellow-green halos. Option C, complete blindness. Option D, night blindness. The answer is option B, diplopia or the yellow-green halos. Option B is the correct answer because visual disturbance, particularly yellow and green halos, are the characteristic sign of the digoxin toxicities. So answer will be option B. Next, digoxin is primarily excreted by the option A liver, option B kidneys, option C lungs, option D GI tract. The answer is option B kidneys because kidneys impairment increases the digoxin half-life and the toxicity risk. So the answer is option B. Next, the nurse should instruct a patient on the digoxin to report option A mild fatigue, option B mild cough, option C palpitations, option C palpitation, dizziness or the visual changes, option D occasional thirst. The answer is option C palpitation, dizziness or the visual changes. These are the early indications of the digoxin toxicity that require prompt medical evaluation. So the answer is option C. Next, which condition is a contraindication for the digoxin therapy? Option A atrial fibrillation, option B ventricular fibrillation, option C heart failure, option D supraventricular tachycardia. The answer is option B ventricular fibrillation because the digoxin can exacerbate ventricular arrhythmias. It is contraindicated in the ventricular fibrillation. So the answer is option B. Next, when administering digoxin orally, the nurse should crush the tablets and mix with the water. Option B give with food if GI upset occurs. Option C administer on the empty stomach only. Option D avoid giving with the milk. The answer is option B give with food if GI upset occurs. Oral digoxin can cause the GI irritation. Giving with the food reduce the discomforts the digoxin affects. The answer is option B. Next, the mechanism by which digoxin slows AV conduction is option A sodium potassium ATPase inhibition, option B increase the calcium exertion, option C direct vasodilation, option D beta adrenergic blockade. The answer is option A sodium potassium ATPase inhibitions because the digoxin inhibits sodium potassium ATPase increase the intracellular calcium which improves the contractility and slows the AV nodes conduction. So the answer is option A. Next, sign of digoxin toxicity in older adults may include option A confusion, weakness and anorexia. Option B is the correct answer because older adults often show non-specific toxicity signs. Early recognition is critical. Next, when giving digoxin intravenously, the nurse should option A administer as a rapid IV push, option B give over at least 5 minutes, option C mix with normal saline and infuse over 24 hours, option D give undiluted into any vein. The answer is option B give over at least 5 minutes. So rapid IV push can cause the arrhythmias slow the administration is safer. So the answer is option B. Next, the nurse should monitor which lab value closely in a patient of digoxin. Option A, sodium. Option B, potassium. Option C, glucose. Option D, chloride. The answer is option B, potassium, because hypokalemia increases the risk of digoxin toxicity. Potassium level should be closely monitored. Next, a patient with the digoxin toxicity may present with option A, tachycardia and hyperactivity. Option B, fatigue, nausea, bradycardia and arrhythmias. Option C, hypertension and edema. Option D, shortness of breath only. The answer is option B, fatigue, nausea, bradycardia and arrhythmias. Next, therapeutic effects of digoxin in heart failure include option A, decrease the cardiac output. Option B, decrease the renal perfusion. Option C, improved the cardiac output and decreased the edema. Option D, increased heart rate. So the answer is option C, improved the cardiac output and decreased the edema. Because by increasing the contractility and digoxin improves the perfusion and reduce the fluid retention. So the answer is option C. Next, before starting digoxin, the nurse should assess option A, apical pulse. Option A, apical pulse, electrolytes, renal function and ECG. Option B, only blood pressure. Option C, only heart sound. Option D, only weight. The answer is option A, apical pulse, electrolytes and renal function and ECG should be monitored before starting the digoxin, because the comprehensive assessment reduces the risks of toxicity and complication. So the answer will be option A. Next, the effect of digoxin on the EKG includes option A, shortened PR interval. Option B, prolonged PR interval and ST segment depression, and C, widens QRS. Option D, QT prolongation. The answer is prolonged PR intervals. Prolonged PR interval like P and Q, then R should be like that. R is T, ST should be depressed like that only. Prolonged PR interval and ST segment depressions. Next, the antidote for the severe digoxin toxicity is option A, atropine. Option B, digoxin immunofab, also known as the digavidin. Option C, calcium gluconate. Option D, lidocaine. The answer is option B, digoxin immunofab or digavidin. Digoxin specific antibodies bind the digoxin, neutralizing its effects in the severe toxicity. So answer will be option B. Next, which is the nursing priority when a patient develops the digoxin toxicity? Option A, encourage rest. Option B, administer digavidin if prescribed. Option C, monitor blood pressure only. Option D, give extra dose to counter symptoms. The answer is option B, administer digavidin if prescribed. rapid reversal with the digoxin specific antibodies is essential for the life-threatening toxicity. That's why if administered digoxin, if prescribed there in the prescription, so the answer will be option B. Next question. Digoxin is used to treat option A hypertension only, option B heart failure and atrial fibrillation, option C asthma, option D myocardial infarction exclusively. The answer is option B, heart failure and the atrial fibrillation. Digoxin increase the contractility and slow the AV conduction, usually in the heart failure and the atrial fibrillation. So the answer will be option B, heart failure and the atrial fibrillation. Next, when teaching a patient about the digoxin, the nurse should advise option A, stop medication if you feel better, option B, take missed dose double next time, option C, report weight gain, edema or the vision changes, option D, avoid the regular blood test. The answer is option C, report weight gain, edema or any types of vision changes, because these are the early toxicity of the digoxin. So if any of these occurs, you have to immediately report to the physician. Next, digoxin increases the force of myocardial contraction by option A, increasing the intracellular potassium, option B, increasing the intercellular calcium, option C, decreasing the sodium in the blood, option D, stimulating beta receptors. The answer is option B, increasing the intracellular calcium, because inhibition of sodium and potassium ATPase increase the intracellular calcium and enhancing the contraction. So the answer will be option B. Next, a patient on digoxin reports seeing halos around the lights. The nurse recognizes this is a side effect. Option B, early toxicity. Option C, allergic reaction. Option D, normal finding. The answer is option B, early toxicity, because visual disturbance are the classical early sign of the digoxin toxicity. So the answer will be option B. Next, if a patient's apical pulse is 55, the nurse should option A, administer digoxin as scheduled. Option B, hold the dose and notify the physician. Option C, give half the dose. Option D, give with the stimulant. The answer is option B, hold the dose and notify the physician, because digoxin can cause the bradycardia. Doses are held if pulses less than 60 beats per minute in the adult patients. So we have to hold the dose, because 55 beats per minute is the heart rate. Next, long-term use of digoxin required monitoring of option A, vision, heart rate, renal function and electrolytes. Option B, weight only. Option C, blood pressure only. Option D, respiratory rate only. The answer is option A, vision, heart rate and renal function and electrolytes, because these are the toxicity of the digoxin. Monitoring ensures the efficiency and prevents the toxicity. Next, Risk factors for the digoxin toxicity includes option A, hypokalemia, renal impairment, advanced age. Option B, hypertension only. Option C, hyperlipidemia only. Option D, young age. The answer is option A, hypokalemia, renal impairment and the advanced age. The answer is option A, because these factors increases the susceptibility to digoxin toxicity. Next, a patient with digoxin toxicity develops ventricular tachycardia. The nurse should give the digoxin. Option B, administer digoxin per protocol. Option C, increases the potassium. Option D, encourage the oral fluids. The answer is option B, administer digoxin as per the protocol. Next question. Digoxin toxicity can be precipitated by the option A, hyperkalemia, option B, hypokalemia, option C, hypernatremia, option D, hypocalcemia. The answer is option B, hypokalemia, because low potassium increases the digoxin binding, leading to toxicity. So the answer is option B. Next, patient teaching for the digoxin includes option A, skin doses when feeling well. Option B, report persistent nausea, vomiting or the vision changes. Option C, stop medication appropriately. Option D, take double dose if missed. The answer is option B, report persistent nausea, vomiting or the vision changes, because these are the toxicity of the digoxin. Thank you everyone. Please like, share and subscribe our channel.